The audience, in the last time, Tay Ninh has continued to record cases of COVID-19 infection in the community. According to the assessment, Tay Ninh is a locality with the highest curve affecting the epidemic. Facing that situation, the Provincial People Committee and the Provincial Steering Committee for Disease Prevention and Control have taken many urgent and timely solutions in local epidemic control, focusing on localizing, tracing and pushing back the epidemic, improving capacity of the treatment, minimizing the number of deaths caused by the epidemic.
In Tay Ninh, there have been many positive cases and clusters in the community, especially many cases of COVID-19 with unknown source in industrial zones in the province. The province has many industrial parks, 5 industrial parks, as well as 2 economic zones at mobile and smart border-gates, with nearly 6,900 enterprises. The total number of employees is about 428,000 people, of which the number of workers in the industrial parks comes to the province is more than 130,538 employees, especially over 37,600 workers outside the province. Many enterprises have a large number of workers, up to tens of thousands of people. Therefore, although the province has established epidemic control checkpoints on major roads and actively engaged in epidemic prevention control, in the last time the province has continuously recorded positive cases related to people returning from Ho Chi Minh City. The risk of infection from the trade of goods and the traveling of people and workers in industrial zones is very high. The risk of additional infections in the community is very great. In addition, the epidemic situation is no signs of reducing in countries in the region, especially in the northern capital and border provinces of Cambodia. Therefore, the positive rate of imported cases is very high. On average, every day there are positive cases on each day. Facing that situation, the province has implemented Directive number 16 of the Prime Minister from July 18, 2021 to isolate families from families, hamlets and quarters isolated from hamlets quarters, communes isolated from communes, districts isolated from districts. All people have been asked to stay at home, only go out in the cases of necessary matters, such as buying food, medicine, emergency, and the carers, civil servants and public employees are working at construction sites, enterprises, factories, production, business and service facilities, essential goods which are not closed or suspended, employees participating in agricultural production and other emergencies. In addition, they need to strictly observe the minimum distance of 2 meters as communicating. Do not gather more than 2 people outside the office, schools, hospitals, and in public places. At the same time, the province has identified areas with high risk of infection for testing, screening, timely detecting and separating COVID-19 infections from the community, implementing blockades and isolation in a timely manner. Synchronously, it has also assessed the risk level and corresponding administrative measures in epidemic prevention and control in localities according to Decision number 2686. Deploy the epidemic prevention and control of localities, preventing epidemic from entering, making medical declarations, screening tests, implementing for on-site option, applying information technology, etc. Strengthen inspection, reminding and administrative sanctioning for violating the observance of regulations on epidemic prevention and control, such as not wearing a mask as leaving the house, gathering more than the prescribed number of people. Directed the establishment of intersectoral inspection teams to check the implementation of epidemic prevention and control measures at companies, factories, enterprises, reminding and administrative sanctions enterprises according to regulations, reminding and widely propagated to businesses about the risk of epidemic outbreaks as well as preventive measures. For markets, restaurants, supermarkets, trade centers, etc., the inspection teams have been set up to guide the implementation of proactive, safe, and effective epidemic prevention and control plans. The province has issued a plan to match its level to the province, along with the handling plan, when there is any case of COVID-19 infection at production and business establishments, industrial zones and clusters in Tay Ninh province. It is also continuing to adjust the plan of receiving, isolating, and responding to each level of COVID-19 epidemic in Tay Ninh province in accordance with the epidemic situation in the province. Localize, expand testing and separate F0 and F1 cases at the company with positive cases to ensure epidemic prevention control measures as prescribed. Especially in the current situation of continuously increasing positive cases, Tay Ninh has paid special attention to the treatment of COVID-19 patients, minimize the rate of deaths, regularly directed the health sector to be more active in epidemic prevention control, especially proactively prepare plans to handle situations when there are positive cases in the community, industrial parks, export processing zones, clinics. Tay Ninh has implemented a plan and process to define the blocks for the collection and treatment of COVID-19 patients in Tay Ninh province, in which clearly specify guidelines on treatment expertise and disease level for each treatment floor, number of human resources, equipment, drugs, and essential supplies for the process of receiving and transferring patients between floors. Except for treatment, Tay Ninh has operated the vaccination for people in the whole province and is currently completing the assigned target of vaccination. Although Tay Ninh is assessed as high risk, but with the determination and consensus of the whole political system, we firmly believe that the epidemic will be well controlled, bringing people's life back to a new normal state.